Hello and welcome. Good afternoon, good evening, depending on which part of the world you're in, to the first PMNCH and WHO live series for the adolescent health and well-being in times of COVID-19. So if you're watching this right now, it means you're pretty awesome because this is the first session, our first series, and I am super excited. I will be your moderator today, and my name is Maziko Matemvu. Now, before we get started and get the ball rolling, I would really like to encourage all our participants to share as much as they can and ask questions. Unfortunately, we can't be able to take up all your questions through audio or video, but then make sure you make use of the chat box. So if you have any questions, any remarks, make sure you make those through the chat box that you have over there. Now, I just want to remind everybody that this is a recorded session, and if you have friends and family that are missing out on this, worry not, because it will be available on the PMNCH website. And the hashtag that we are using for this live series is hashtag adolescents 2030. So hashtag adolescents 2030. I will introduce all the speakers, and then we will get into an interactive sessions with the students, and I'm super, super excited. And I think this dialogue is very important because COVID-19 has affected all of us, and the topic for this session is reopening of schools. And in many countries, schools have shut down as a way to respond to COVID-19. I'm from Malawi, and here in Malawi, a lot of schools have shut down, have closed, and the government at some point tried to introduce online learning, but over 80% can't access the internet. So it wasn't an effective method. And currently they've just closed down and shut down all interventions because it's not really inclusive. So I am so excited as well because I'm sure I will share the evidence-based research and recommendations that will be shared today, so that I can also share with the governments and policymakers in my country. And I hope you will be paying attention so that you are able to relay this information to your peers and also to policymakers. Before we start, I would like everybody, I know you think I can't see you right now, but I actually can. I am literally looking at you right now. So I want you to take out your phone and tweet, whether you're on Twitter, you're on Facebook, you're on Instagram, you're on WhatsApp. Take out your phone and I need you to use this hashtag right now. Tell the world that you are here at the PMNCH and WHO first live series. I need you to use that hashtag adolescents 2030 right now. I'm giving you 30 seconds. Take out that phone. Take it out, take it out, take it out, take it out. Yes, 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 I can see you. You're not taking out the phone. Take it out, and I need you to tweet and write that you are here right now and use the hashtag adolescents 2030. I need the whole world to talk about this session. I need this hashtag to go viral right now. All right, I'm sure we've all done that. So what I would do right now is I will introduce our speakers. So first we will have a keynote speech, and then we will have an interactive discussion with two students that I will introduce. I am just going to introduce our amazing speakers right now, and I'm sure you're pretty excited and you're anxious. Who could they be? Who are these people? So first up, we've got Chris Castle. So he's the Chief Section of Health and Education at the UNESCO headquarters in Paris and France, which is in France. And then we have Valentine Baltag. So she's a scientist and works at the Department of Maternal, Newborn and Child Health at the WHO, which is hosted by WHO. And then we have Sauba Nakasaga, who is from Gulu University, and she's a student in Uganda, Wakiso. Then we also have Shutki Ananta, and she is she's a high school student from India, and I am pretty excited and honored to have all of you right here, right now. And I just like the diversity. You know, we're always talking about young people, but you always find somebody speaking on behalf of young people. But we have these students. So excited to have Salva and Shutki as well. I'm really not being biased. Sorry, Chris and Valentin, but I'm really excited that we've got Salva and Shutki here as well. So at this point in time, I think I would like to throw this to WHO and UNESCO to present a keynote presentation that is highlighting findings from the recent issues around schools reopening and COVID-19 as well. So over to you, Chris and Valentin.
Thank you very much, Maziko. So with Chris, we will be presenting just an overview of key issues around school reopening, and we are happy that this topic was chosen for the first event of the live series. Next slide, please. So we will cover some key issues, such as what do we know so far about the risk of infection in school-age children, and then what is the role of children in transmission, what is the role of schools in transmission, what effects school closures have had on students' health and well-being, and then Chris will update us on the status of school reopening, and also we'll talk about what are the current recommendations for public health measures for school reopening. Next slide, please. So as we are now in the phase that many countries do reopen their schools, and some do consider to reopen in nearest future, some of the key questions is around how safe is it to reopen school? And in turn, this question, how safe is to reopen schools, depends on answers to the questions such as, are children at lower risk of infections than adults? So what do we know about that? From data reported to WHO, children and adolescents up to 18 years of age represent 1 to 3% of reported infections, even though this age group makes up 29% of the world population. It looks like young children do not seem to be affected as much as other age group, but when children are affected, then most would experience mild disease. There will be very few deaths among children. However, there have been cases when children did experience severe critical disease and some children have died. Now, while children may be less affected, they may also have a greater number of contacts in school and community settings. Therefore, we need further studies to understand and to assess the risk of infections in children and to better understand the transmission of this age group. Next slide, please. Now, one question is whether or not children are at a different risk of the infection, but a question on are children transmitting the infection onwards is also important. Now, again, the role of children in transmission is not well understood, but there is some evidence that children and young people play a lesser role in transmission of the virus SARS-CoV-2 at a population level. We also have to understand that when we talk about children, is a pretty large cohort from 0 to 18, and there are subgroups of children and adolescents that might have different risks and different patterns of transmission. So what we see so far is that the role of older children and adolescents, even though the evidence is still mixed, there is a suggestion that their role in transmission is closer to that of young adults than of smaller children. And therefore, the advice on the use of masks in children that is currently under development should differentiate and propose a different approach for younger children versus older children. And although the analysis of transmission chains and clusters suggests that children may be less susceptible to infection than adults, the evidence to support this remains weak. Next slide, please. Now, A third question is, what is the role of schools and other congregational settings in transmission? So the role of children in transmission, but the added question is, do school as an institution add or subtract from any risks observed in non-congregational settings? We know so far that from all reported clusters, about 4% are linked to schools. That's not much, so 4% is a low proportion. Among super-spreading events that were analyzed, less than 1% were reported in schools. And also, when school clusters are reported, the information points toward a higher number of cases among staff and parents, though this could be related to differential in clinical presentation and subsequent testing. Next slide, please. Now, the COVID infection and acquiring the infection by children and students is an event in the health-related consequences. But there are other consequences that are not COVID-related. And we know by now that school-age children and their families face additional challenges as a result of this pandemic. Just to illustrate, you see the figure on the right-hand part of this slide. At the time when about 163 countries have reported school closures, more than 300 million children did not have access to safe meals. This comes from the Global Monitoring of School Meals during COVID-19 School Closures database. That's just one of the examples. We know that school closures as part of preventing COVID-19 spread can have and did have a detrimental impact on children and adolescents and parents, especially among families of low socioeconomic status. And this is largely related due to the disruption of very often school-based essential services, such as school meals, mental health services, speech therapy sessions, peer support groups, immunization, sexual and reproductive health services. For many children from disadvantaged groups, the schools is the only setting or the most accessible setting where they can access those services. So therefore, the negative impact can include interrupted learning, non-return to school, poor nutrition, social isolation, negative mental health effects, and increased child abuse. So why this is important? It is because when we decide about school closures and school reopening, we have to balance the potential benefits of epidemic containment, if we have evidence that indeed school closure is a good strategy to achieve those, versus those other impacts on the health and well-being of school-age children. And now I will invite Chris to share with us the status of school closures and school reopening. Next slide.
Thanks very much, Valentina, and certainly also to WHO and colleagues there who've invited UNESCO to participate in this very important webinar. It's great to be with you, and it's a wonderful opportunity. So the slide that you can see up on the screen now is, it shows you in real time from the beginning of the year up until where we are now, the different countries who have closed their schools. Most governments around the world have closed their schools, or what we say their educational institutions. So that means right up from pre-primary or kindergarten all the way through to university level. And we've been monitoring that at UNESCO since mid-February and tracking that in real time. During the peak closures, which occurred in the first 2 weeks of April, 194 countries simultaneously closed their educational institutions, which impacted 90% of the student population around the world. So I think all of you on the call were probably personally affected by this, as were so many other student populations around the world. While about half the countries around the world, 104, impacting 450 million students, have reopened either partially or fully, or are planning to in the coming weeks, the situation is still very uncertain, and hundreds of millions of students around the world are still not entirely sure where things are going to go. And I'm going to talk about that just a little bit more with the next slide. So more specifically, in 18 of the most densely populated countries with more than 404 million students, we still don't have a decision yet no decisions have been taken on when schools will reopen. And that's partly because, as Valentina was explaining, we have to take a lot of different factors into consideration, particularly the safety of reopening those schools, not only for students, but also for their teachers and other school staff. Today, schools in 117 systems, which serve 654 million students, are on scheduled academic breaks. So this is a period around the world when many students aren't in school anyway. And they're expected to return at the end of August or the beginning of September. But as I said, it's still unclear whether what that return to school will look like. And of course, UNESCO and its partners are in the process of collecting that information from countries as they reopen. To date, we've calculated that children have lost on average 60 academic school days, which is about 1/3 of the official number of school days in a given academic year. So 1/3 of learning opportunities have been lost. And therefore, learners are missing out on the many benefits of schools, not just learning, but as Valentina reminded us, access to school meals and nutrition, referral to other services, schools as a safe place, all those important benefits of school in addition to learning are missing. And for some countries, unfortunately, the next time a child will be in a physical classroom may be several more months down the line. We're just not sure yet. In the countries that have reopened, even though that's been relatively brief, the strategies for partial reopening have included prioritizing certain groups, for example, maybe younger children. And as Valentina told us, we have evidence to suggest that they may be less vulnerable to the virus than older children. And in others, students subject to, for example, high stakes examinations at an older age have been given permission to come back to take those exams. Full school reopenings have rarely been similar to the school environment before the pandemic. So we all know when we go back to school, we can expect to see some changes. That includes things like school shifts, so that we have fewer numbers of students in the school at one time, so they can social distance, they can stay further apart from each other. Breaking up classes into smaller groups and rotation, all in order to help respect strict health and hygiene guidelines. And these vary from country to country. The national authorities take their guidance from the World Health Organization and others and then apply those to the local context. And those can also include things, for example, like physical distancing and the use of face masks, ways of reducing exposure, improved hand washing and encouraging more hand washing. We all know we're supposed to do that now anyway, right, when we're not in school, but even when we're back in school, we have to continue washing our hands as much as possible, and other measures to ensure the safety of staff and students. And that may also, for example, include in some places temperature checks in schools. Next slide, please. So this is just a quick slide to show you that UNICEF, UNESCO, and the World Bank have also launched a survey. We have 3 different surveys where we're looking at different aspects of school reopening, and I'm not going to go into the details now to save time, but just to share with you really that this is an area that lots of different parts of the United Nations system are looking at very carefully, so that we can provide the best available data and guidance to countries so they can make the best decisions about school reopenings. And now I guess I turn back over to you, Valentina, to continue.
Thank you. So what are the current recommendations for safe school reopening, and what guidance from WHO, UNESCO, and other UN agencies is available to help policymakers? And also to give a peace of mind to students, to their parents, and to the communities that school reopening indeed can be a safe endeavor. Next slide, please. So in this slide, I pulled together some of the considerations that should be taken into consideration when decided whether to reopen schools or keep them open. Deciding to partially close or reopen schools should be guided by a risk management approach to maximize the educational as well as health and well-being benefits, not only for students, but also for teachers, staff, and the wider community. And a risk-based management approach is about identifying and assessing the local situation and epidemiology of COVID-19, and acknowledging that this may vary from one place to another within a country, not only between countries. And several elements should be assessed in deciding to reopen school or keep them open. First is to assess the benefits and risks. What are the likely benefits and risks to children and staff to open schools? And this would include considerations such as what are the trends of the disease? For example, are COVID-19 cases being reported in the area? Are they diminishing? Are the cases increasing? Things like that. Then what are the effectiveness of remote learning strategies? If the epidemiology is such that it might make policymakers to decide to keep school closed or partially closed, then one would have to think if remote learning strategies are working. And also one of the important considerations is the impact on vulnerable and marginalized populations, for example, girls, displaced populations, disabled children, etc. Another consideration is the capacity to detect and respond. Are the local health authorities able to act quickly? And then collaboration and coordination. Is the school collaborating with local public health authorities? Are the mechanisms set to, for example, when a case is identified in school, then to connect with local public health authorities and follow a protocol? In addition to the local situation and epidemiology, a careful assessment of the school setting and ability to maintain COVID-19 prevention and control measures needs to be included in the overall risk analysis. Now, I refer for more guidance on this topic to the document, which is referenced. You can find it under the link provided on the bottom of this slide. And this is the document, next slide, please, which is called Considerations for School-Related Public Health Measures in the Context of COVID-19. For example, this document outline considerations related to the physical space in schools, to the infection prevention and control measures, to the transportation to and from school, and all related scenarios and considerations. Next slide, please. Based on this guidance, WHO also developed a Q&A on schools and COVID. You can access the information and the answers to those questions under the link provided. And the questions that the answers are provided are listed on this slide. For example, what is the role of children in transmission? Should, for example, children with underlying health conditions or teachers and other staff with underlying health conditions return to school? What is the incubation period for children? What should be considered when deciding whether to reopen schools or keep them open? What benefits would school reopening provide, etc.? And very important, the last question, what should be monitored after reopening of school? We have to understand that this is the COVID pandemic is a unique situation. We never faced it before, and everything we are doing is new. So we have to learn, we have the responsibility to learn from what we are doing. And school reopening in the context of COVID is a new strategy, and we have to learn. And this can be done by monitoring certain things and improving, making schools that did reopen a safe place to learn and be. There is more guidance available. I will again hand over to Chris to highlight some of the documents.
Thanks, Valentina. And just maybe to say a word, I think everybody on this webinar understands how important it is that we have trusted sources of information, right? Unfortunately, we live in a world where, you know, there can be some misleading information or some fake news. And I know that from where I sit at UNESCO, we really appreciate the guidance that comes out from the WHO or UNICEF or the Red Cross or other trusted sources. And I think now more than ever, all of us can play a role in making sure that we refer to that accurate, trusted, evidence-based guidance. You know, we need that to keep safe and to have a safe experience when we are able to go back to school. Here on this slide, you can see two examples of some guidance that's come out. The first one on guidance for COVID-19 prevention and control in schools was produced by UNICEF, the World Health Organization, and the Red Cross. And this is, you know, a really important reference, again, based on science and evidence, the best we know about this virus and how to prevent it. And it's things that you've already heard about in this presentation, but it's reflected in this guidance. And it really is important that we all do our best to apply and follow very carefully the guidance that's suggested here. And then on the other side, this is a framework for reopening schools that was produced by UNESCO, UNICEF, the World Bank, and the World Food Program. And here as well was an example of really providing countries with a framework of things that they need to consider, because there's a lot of issues to think about when we want to reopen schools after they've been closed because of COVID. And I think the idea really is to try and make sure that we're as prepared as possible, and that students and teachers and other school staff can return to school safely, and we can resume our physical presence in the classroom to have the best experience for learning, which after all is what schools are primarily about. On the next slide, here's some good news for those of you particularly on this call. There's a lot of materials that have been produced that are directly designed to relate to young people themselves. So some of the stuff that Valentina and I have been sharing and talking about are really for like the decision makers, the school principals, the minister of education, and they have very important issues and decisions to make to decide when to safely reopen schools. But we know that you on this call, you, the young people, children, learners, have a crucial role. We're only going to succeed in getting ahead of this epidemic if we all do our part. And so a lot of great materials have been developed directly for you, because we won't find solutions if we expect it to come only from the adults in the world. We have to sort of make sure all of us play our part. And so these are some examples up on the screen, and at the bottom you can see that there are many different places you can go to for great information, and one is the UNESCO Health Education Clearinghouse. And there's a link here that you can go to, and these materials are available in lots of different languages, and they're free. Some of them include animated videos if you prefer to get your information in a more lively way. But again, the good news is there's lots of excellent materials out there. Just like I said, pay a little bit of attention to the source of those materials and make sure you feel that they reflect what you've been learning and understanding about how to safely return to school in the context of COVID-19. Valentina, back to you.
Thank you. So here are some key resources that we highlighted with the web link provided, and at the end of this webinar, we will refer to some more resources which we did not talk on this presentation, which was purely focused on issues around school reopening. Over.
Well, thank you very much, Valentina and Chris Castle, for that very insightful presentation. And I think a lot of us who are on this call right now could pretty much relate with everything that was being said. And I really like how you kept mentioning about evidence-based and ensuring that we're accessing correct information. And everybody watching this, I hope you guys took notes and paid attention to the material that was shared to us. And I just wanted to say that let's make sure that we're accessing correct information. My mom goes crazy. She's always sending all these weird and random things. So let's not be like my mom, please, because I hope she's not even watching this. Sorry, Mom. But anyway, so we have a question. We've got so many questions, and I really wish that we could answer all of them. But unfortunately, with our time, I'm just only going to pose one question. So I'm not sure if Valentina or Chris would take this up. But it says, while schools remain shut, what can be done to address increased sedentary behaviors due to online classes, social exclusion, mental health related issues? What do WHO and UNESCO recommend on addressing these unhealthy behaviors? I'm not sure if I see, Chris, you're nodding your head like you want to take that.
Either I or Valentina, or maybe both of us quickly. It's a really good, it's a great question. It's very, very important. I mean, I think, let's face it, all of us have now had many months of experience, right? Trying to maintain some kind of distance learning during school closures at home. And I think many of us know now that even if we're fortunate enough to have internet access, plus a device that allows us to access the distance learning materials that our schools may be able to provide, it's still really difficult. And it doesn't, in my experience, really replace the benefits and the kind of learning that we can have when we're physically together in the classroom with our teacher. But when we are at home and we have to sort of maintain, as you say, physical activity and mental health, there are some tips that are out there that can be really useful. UNESCO produced an animated video that you can find on our website called Top Tips for Learning at Home. And it includes things like suggesting that if your family is large and your house is small and you need sometimes just to have some space to yourself to think and to study, maybe you can negotiate that with your brothers and sisters and your parents, just to kind of keep yourself calm and to have that opportunity to think a little bit, to work on your studies. Share your tablets or your devices or the computer, because there may only be a limited number or only one in the household, and there may be several children who are trying to maintain their learning. And so we all have to sort of play our part to make sure that everybody has equal access to those kinds of opportunities. And there are some suggestions about stretching and exercises that we can do at home. It really does make a difference in terms of our sense of well-being. So yeah, thankfully there's some really great experience that we've learned from confinement or lockdown when we've had to be home during school closures. But Valentina, you may have some other advice as well.
Thank you, Chris. No, absolutely. Being physically active has also mental health benefits along with all the other benefits. And the WHO recommendations for the physical activity are not less challenging in COVID as in non-COVID situation. We still recommend for children 60 minutes of physical activity every day, and for adults 150 minutes per week. So what can you do when you are at home and in isolation? You have to absolutely try and reduce the time spent on sitting, move around. If you are in a Zoom call, you can do it with your headphones and walk around your home. Set up a regular routine and find out ways and improvise, for example, with improvised weights to keep up your routine. If you were physically active before, you can do jogging while keeping physical distancing, and set up some physical activity goals together with your sibling, with your family, with your friends. You can meet online with friends to do physical activity classes. And we will refer you to the WHO resources and other tips related to physical activities on WHO website.
All right, thank you, Valentina and Chris, for all the insights and the advice that you've given. I think it's very, very important that we stay healthy, and thank you for answering the questions. Unfortunately, we have to quickly throw it back to Salva and Shukti and really start to understand what are young people facing during this, the pandemic and the schools closing. So I hope Salva is ready. Salva, are you here? Sorry, Shukti, apologies. I think we have to start with Shukti. Shukti, are you ready?
Yeah, I'm ready.
Okay, great. So Shukti, we understand that classes have moved to digital platforms. Please tell us how this has impacted your life as well as your peers, and also what challenges are you facing to maintain the quality of education?
So personally, like, my daily routine has been completely disturbed. Like, before, I used to go to school, I used to wake up early and I used to do my homework. I used to have like a regular routine to follow. But like, due to the pandemic, there's a lot of distractions around me. There's social media, and there's a lot of distractions, and we're not able to focus on our daily routine. So there's a complete end to our daily routine, our studies, our proper timings. So all that has come to an end all of a sudden. So, and I'm also a science student. So like, for me, we have to go to the labs, we have to study practically, we have to touch the experiments, we have to understand the essence of science basically. So now everything is limited to theory classes, so we can't practically understand science. So that's a huge challenge. Also in my high school, we have a platform called YouTube. So we listen to all our classes on YouTube. And it's really effective in many ways, because we can rewind our classes, we can watch it whenever we want, wherever we want. But also the hugest challenge is that we can't interact with our teachers. We can't ask them questions, we can't understand them. So we have to, it's limited to just one side. So there's no two-way kind of teaching methodology. Also, not a lot of people can afford high-speed internet or like the appropriate technology to access online classes. So that's a huge challenge. And most of my peers use the Zoom app as well. So that's a very nice platform because you can interact with your teachers, you can ask them questions, but also you have to pay a lot of attention. You have to be at the moment. You can't skip out on any points. You can't rewind the classes. So that's one of the challenges that I've noticed. Also, the quality of my education has deteriorated drastically because in class we can talk to our teachers, there's eye contact, there's group discussions, there's effective learning methods. We can talk to them, there's live brainstorming. So now there's none of that stuff. We just have to sit behind a screen and look at their face, and there's no touch and feel method, I feel. And the excitement of answering a question, all of that is completely gone. So it affects the understanding of our chapters and our lessons basically. And it's not easy, but we're finding ways to adapt to this new methodology. And it isn't the same without your classmates. It isn't the same without your peers sitting next to them, talking to them, and having a teacher solve a question for you. And I've also noticed that the teachers aren't feeling the same way about this. Like they aren't going with the same pace and the same clarity that they used to go while they were with us, like face to face. So that's a huge issue. So I just want to ask school authorities and government officials to understand the difficulties that students are going through and reduce the syllabus comparatively, and also like conduct assessments or examinations via online platforms rather than having it at the centers, because it's a huge risk for most of them. And also have an interactive class where they can understand our difficulties, our challenges, and address them, and provide adequate solutions to it also. So I hope that we can all look at this as a life lesson and be grateful for all that we have right now, and look forward to this as something that we can grow from. Thank you.
Wow, Shruti, thank you. Thank you very much for that. I really tried to not drop a tear because that was just really touching. And I think it's very important to have these dialogues, like I mentioned before, to really understand what students are going through. And what you just mentioned, being able to be next to your colleagues and to see them, and the excitement of raising your hand in class is no longer there. And thank you very much for that. So you're a high school student. Let's hear from a university student. So we have Salva. Salva is from Uganda. And Salva, please share with us, how has COVID-19 affected you and your peers? And are there any specific groups of people that are facing challenges due to this pandemic? Over to you, Salva.
Thank you, Maziko. Well, it was on the 20th of March when all schools, universities, and institutions were closed due to the COVID-19 pandemic. We were forced to come back home. My university didn't have any plans for us as far as our studies are concerned. So I personally resorted to personal revision, which turns out to be boring sometimes. And this has really, really affected my studies negatively. And also the small-scale businesses we operate when at university have been affected. How? Because right now I can't sell my stuff, so it has affected my income rate. And in the sports arena, some of us who participate in activities in sports when at school cannot have that training we have when at campus. The training we get when there is not the same training we have at home. At home you're reluctant, you're busy with your phone, you're busy with housework, to mention but a few. However, on a happy note, this lockdown period has given us time to bond with our families, which wasn't the case before. However, it has come with a negative impact on some peers. For example, they have been experiencing family conflicts because they have experienced and they have witnessed their parents have fights, quarrels in their presence. And they have also been battered. Some have been exposed to gender-based violence, which has forced many to run away from home. And even when schools reopen, they may not be in position to go back to school. I've also witnessed child labor among my peers. I've also seen children under the age of 15 sell stuff, like in my hood, just to earn income for their families. Meaning even when schools reopen, such children who have been exposed to income generating activities may not be interested in going back to school at all. Then there has been a case of early marriages. For example, in my hood, a 15-year-old was married off by her family, claiming they couldn't take care of the big family anymore. And guess what? It was in exchange for food. There is also early pregnancies among my peers. For example, I have friends who stayed at campus in hostels, so they decided to move in with their partners. They've engaged in unprotected sex probably, and they're now expecting. Meaning when schools reopen, they may not be in position to resume with others there and then. And then I'm also happy to say that it has given us time to engage in hands-on activities. For example, I personally do some tailoring. I make such face masks, which I thought to earn some income. Then I've also tried to do some farming around home. It is really good and a nice experience. It wasn't the case before during the school times. And then the specific groups of young people facing difficulties in this lockdown include persons living with HIV. Due to the ban on public means of transport the previous month, they could not access their ARVs on time, and this has worsened their health situations. And then the adolescents and young women who couldn't access safe and hygienic sanitary products due to the hiked prices resorted to cheaper and safe means, which has affected their health. And then we also have children with disabilities. For example, some schools have been conducting online classes, but then some children were not thought of, like persons with visual impairment and hearing impairment. There were no sign language interpreters. Thank you very much. Back to you, Maziko.
Wow, that was very powerful, Salva. Thank you very much for sharing that. And I know with Shukti, I said I think I'm actually really just emotional. I'm not gonna lie, I'm just an emotional person. And just hearing that, some young girls are being married off for food is really just heartbreaking. But these are the realities in our communities, and we need conversations like this so that we can really discuss on the way forward and discuss on concrete solutions. So for this next session, I would really just like us to just have a dialogue. I'm going to talk with all of the speakers right now. Chris, Valentina, Salva, and Shukti, I know you guys are ready. And if you have any questions for our speakers, please make sure that you comment in the chat box, and we will take that into consideration. And please do not forget the hashtag Adolescents 2030. We've heard a lot from Chris, Valentina, Salva, and Shukti. We've heard a lot of information, and we've had different perspectives, and we want to tweet about it. If you haven't been tweeting about it, I'm not very happy, and you want me to be happy. So please tweet adolescents, hashtag adolescents 2030. Okay, so I think we can start with Chris. So for this next session, let's make sure we just keep our responses to 2 minutes, because we're running out of time and we want to discuss more. So I just want to implore and just reiterate to our speakers that please, let's just keep this to 2 minutes. Chris, what are your recommendations around comprehensive sexuality education, considering the current context?
Great, thanks so much for that question. And in fact, I've been watching the excellent questions in the chat, and some of you on the webinar also asking questions about, how do we maintain the sexual and reproductive health and rights of young people during confinement. And Saba herself actually gave that wonderful and moving example of, people living with HIV who have to still get access to their medicine. So there are some important and serious challenges out there when it comes to comprehensive sexuality education, or whatever it's called in your countries. And we know the name changes locally. But what matters is that we know that young people, despite COVID-19, still have feelings and still want to maintain relationships or explore new relationships. And it's important for us to remember that. UNESCO has conducted some focus group discussions with young people in partnership with the AIDS Health Tech NGO. And one of the things that came up very clearly from from our discussions with young people was that they all said, look, yeah, we're confined at home, our schools are closed, but we're still finding ways to like meet up with our friends and to maintain the relationships that are important to us. And unfortunately, just as Saba shared that example of how it may be challenging to find access to safe sanitary projects to maintain good menstrual health, it's also similarly challenging to make sure that we have access to the commodities and the services we need to maintain good sexual and reproductive health. And just because of COVID doesn't mean that we want to make unsafe choices when it comes to our relationships. And I think everybody on the call, particularly older young people, will understand what that means. It's about really making sure that we think about protecting ourselves and our partners safely. And we've hopefully all had instructions on how to do that through school or out of school from our parents or through the community or our churches. And so I guess I would just say, don't make unsafe choices just because we're living in the context of COVID-19. Thank you.
You know, I'm always laughing at people who always speak without unmuting themselves, and I just did that, so shame on me. But thank you very much, Chris, for that. I think it's very important, and I think that is such a takeaway. Don't make unwise decisions because of the context that we're in. All right, so Valentina, how can services be delivered to students if schools are closed? What are the guidelines to keep these services available, and just also taking into account that not everybody has access to the internet and technologies and has this privilege that we currently have right now?
Thank you. And I was having problems with my mic. I want to check with you now that you can hear me.
Yes, Valentina, we can hear you. Thank you.
Okay, thank you very much. So there is a number of services that we consider essential services. And for example, health education, mental health services, food security and nutrition services are among of those essential services. And WHO recommends that COVID-19 or not, those services should be provided. We should ensure a continuity of those. Now, there are modifications to be made to how those services can be provided in the context of a pandemic. For example, school and community-based health education can be integrated and broadcasted into the TV educational programs. There might be telehealth mechanisms for the provision of counseling, for example, about preventing NCDs, for example, the issue of physical activities, and also to provide brief interventions. For school-based and security services, there should be alternative strategies to safeguard children's food security and nutrition by providing micronutrient supplements and other mechanisms. Similarly, for mental health promotion, prevention, and treatment, there might be some home-based activities that are safe and entertaining to practice. One would have to have contingency plans, how to organize mental health services during school closures, and also use remote socio-emotional learning programs and strengthen the capacity of schools and mental health staff and youth champions to deliver them remotely. So basically those essential services, and the list goes on: sexual and reproductive and HIV services, prevention and response to intimate partner violence is an essential service, and there should be alternative strategies how to deliver them. And the WHO guide, which is called Maintaining Essential Services in the context of the pandemic, highlight the exact, what are the modalities, what are the alternative ways to deliver those services, and what should be done when those services reopen. What can we learn and how we can strengthen those services' resilience for such context. Over.
Thank you very much for that, Valentina. Please, to all our amazing participants, hashtag Adolescents 2030, hashtag Adolescents 2030. We're going viral, we are going viral, and you cannot be the reason we're not going viral today. So over to you, Shukti. How can students be engaged in active learning through digital forums or digital means, really?
I think active learning means interactive based learning. So I think via the Zoom app, or basically any app which offers communication both ways, and not limited to just one-sided like teaching methodologies. So where you can communicate with your teachers, you can ask them doubts, you can text them, you can like you can just talk to them and ask them questions. So I suggest apps where you can talk to your teachers and interact like in both-sided ways.
Wow, thank you very much for that. I think that really is important. And for Salva, what are the key SRHR related barriers to adolescents returning to school, and how can we overcome them?
Um, well, the high rate of early pregnancies
Wait,
among
sorry,
university and
Salva, I actually just realized you gave us the challenges that young people, young girls are facing. So let's talk about the solutions, because we're always talking about problems. It's easy to talk about problems. So I'm putting you on the spot. What are the solutions? Please let us know.
Okay, well, on the problem of high rates of like early pregnancies, I think we should preach like effective and consistent use of contraceptives. For example, condoms. When they use protection, they will not conceive. So I think that problem will be solved. Yes, Maziko, back to you.
All right, thank you very much for that. And thank you very much for your insights. I think there's so much that's going on in the chat books. People want to know and ask our amazing speakers. You are amazing, all of you. Yes, all of you. Amazing, amazing, amazing. So I know you have so many questions, and please let us ask our speakers any questions. I will be taking about 2 questions from our audiences. So this is your chance to have your voice heard. I'm just going to give it 20 seconds, and I think I'm just going to wait for Sharaf to help me sieve out the questions so that our amazing speakers can respond. Okay, so as we are waiting to hear other questions being posed to our speakers, I see there's a question from, okay. All right, so it says most students in India, I think Shukti, you can take this. Most students in India attend low-funded schools, so they can't afford online education. And even teachers are not familiar with this technology. So students have already missed 4 months of classes, and government has announced to open schools in November. And to find the solution, they launched a TV channel for low-funded schools, but rural students cannot access them due to lack of electricity. So how do we really resolve this issue? Because Shruti, you talked about apps and all that stuff, but there's some people who actually don't know what apps are, you know? How do we really address this problem?
Yeah, I think that's a huge challenge in rural India. Basically, a lot of people don't have access to electricity, let alone apps or laptops or phones or internet as such. So I think maybe they can have like small groups of students, like very small groups of students, sit at home and ask like a professional teacher to come home and explain some of the chapters in very small groups, rather than like immediately reopen schools or colleges and have huge groups and create another more spreading of the virus. So I think they can do that. And basically I think they have to reduce the prices of like electricity and give a lot of discounts on internet. So this is like a huge challenge for India, and in India, for rural India especially. So I think the small groups of students kind of a plan might work. It's just my perspective.
All right. Okay. So I think that's very important to reduce the fees, and I think something that we're also struggling here in Malawi is our data is so expensive, super expensive, and people are just advocating to have that reduced. So I have one more question, and maybe Chris can take this up. So how can students' confidence be built in going back to school safely without anxiety? I think mental health is an issue that's been coming up. So how do you really encourage students who are watching this right now? What can they tell their peers to deal with mood disorders or emotional disorders or whatever disorders really?
Sure, thanks for the question. So I guess part of my thinking there about this question is that if you're already on this webinar and you're engaged in this discussion, you're really lucky because you're having access to a lot of really great information that can hopefully put your fears at ease. And I think that's part of the answer to the question, is really that we want to try and make sure that we're spreading reliable science and evidence-based information amongst ourselves. We're dispelling myths. And I guess we're also trying to really build a sense of community and a sense of social norms, so that it's not cool if you're not wearing a face mask and the school wants you to. Or it's not cool if you don't want to wash your hands, but the school says, look, come on, we all need to wash our hands again. We need to create an atmosphere where it's cool to be hygienic and it's cool to follow the rules. And it's cool to do that because we care about each other, not just ourselves. And we understand that even if we're a young person, and as Valentina said, younger children in particular may be less likely to experience severe symptoms of this disease, they can still spread it. And so we all have a critical role to play in terms of helping to keep our communities safer. And so I think, that would be my answer. And also just to make sure that everybody, all young people, understand that they're not just passive beneficiaries of education, right? You have a voice and a critical role to play in helping make sure that we can turn around the risks and the continuing spread of coronavirus. And so your actions and your behaviors are super important.
Thank you very much for that, Chris. To all our participants, remember #Adolescents2030, #Adolescents2030. And I know we're running out of time, but please stay with us just for a few more minutes. We're actually just wrapping up. I know you're enjoying this dialogue and conversation, because I am. I would actually want to stay till like 9 p.m. It's around 4 this side. But we'll just finish up in a couple of minutes. So I would please like to implore all our amazing participants to just stay on. And Chris, that was actually, I really tried to stifle my laughter because that was really cool. I think that is cool. Let us make hygiene like such a cool thing. You know how when somebody doesn't wear like a cool brand or something, it's not cool. But if somebody's not wearing a mask, let's make that person know that that is definitely not cool, because it is super cool to wash your hands, to wear a mask, and practice social distancing and all the other safety measures. So at this point, I would really love to thank all our amazing speakers for their valuable insights and to sharing what they are going through and experiencing, and all the verified information. That's very important. I mentioned before, do not be like my mother, just randomly throwing things from God knows where. Let's share verified information. And I'd like to thank you very much for sparing your time to this amazing webinar series. So at this point, I would really like to just throw it to Valentina to please share with us the resources and key messages for action.
Thank you. So next slide, please. I will briefly just highlight the sources of information and some key topics that you can find on WHO website. So this is the homepage and of the WHO website, and you can see that you have here resources for different target audiences, and here is the advice for the public. So I do encourage you to access this and look what is there, because it will answer many of your questions. It will also help you alleviate some of the fears you might have, and also help your parents, Maziko, share those resources with your mother. She might feel more confident after that. Next slide, please. So some highlights from what you can find on WHO website. First of all, it's Q&A and WhatsApp on COVID-19 and related health topics. There is a whole very, very long list of topics related to COVID-19 that you might want to ask and you have the answers. There is also the WhatsApp. If your question is not in this list, please submit and have a chat with WHO and you will have a response. Next slide. Among the long list of Q&As, there is one I highlighted in the first part of the presentation, the one on schools and COVID. We have also one on adolescents, youth and COVID. So issues around mental health, sexual and reproductive health, stigma, online safety and other issues that might be of interest you can find here. And you have also the PDF files. So I think this is important, the ones highlighted in yellow. We made those Q&A in PDF, so you can spread, you can use them and disseminate. Next slide, please. Mythbusters, that's a hilarious part of WHO website. You can see the topics on this slide and you have the questions and the facts which are given against the myth around the topic. So this is again a very useful resource. Next slide, please. We talked about how important are some essential services and how to ensure the continuity of these services. There is a WHO guidance on that. And it has a section on child and adolescent health, which tells policymakers and other stakeholders what exactly can be done to ensure the continuity of some critical services for children and adolescents. Look it up. It is written in a very user-friendly, reader-friendly manner, and you will know what can be done to ensure alternative strategies for the delivery, for example, of sexual and reproductive health services. Next slide, please. Again, resources on mental health. Here is, for example, a storybook to help children and young people to cope with COVID-19. But there is also more advice, keeping mentally health while at home, coping with stress, helping children cope with stress during COVID-19 outbreak. So this all is very helpful. And this is applicable to school setting, because one of the questions in the chat was how we can help teachers to manage the class, not only in terms of behavioral, but in terms of the well-being. So those resources are applicable as well. Next slide, please. So what would be some key messages for action? I think Chris said, first of all, stay aware of the latest information on COVID-19 outbreak and use reliable resources. Get engaged, and this means not only knowing for yourself how to protect yourself, but to ensure that your community and your school is safe. And contribute more specifically to the topic of this event is contribute to make school reopening safe. Respect, protect, promote, monitor, and improve. While you are in school, advise your peers as well to respect the measures, to protect themselves and their peers, to promote the measures that needs to be put in place, but also help to monitor and improve and help us all to learn from those early experiences. Thank you very much. Over.
Wow, thank you very much for that, Valentina. And my mom says thank you, I'm pretty sure, for all the verified information that you have shared. And I just wanted to remind all our amazing participants that we will share all these resources and presentations with you because you registered and we have your email addresses. So we will be sending them directly to you. I see other people are directly reaching out to the speakers to just ask more questions because I know there hasn't been so much time. So I'll just implore you to just take their names, Chris Casso, Valentina Baltak, Shukti Ananta, just take their names and reach out to them directly because they're more than willing to answer more questions. And at this point, I really just want Mihail to just get ready with the poll. And I just want us to stay for a few more minutes because obviously this session has been amazing. We've loved the discussions because it's something that we can relate to. And we want to make sure that for the next discussion, it's something that we want to talk about and things that we are personally going through. So we are going to, there is a quick poll that all of us are going to participate in to just find out what do we want to discuss in our next session for the adolescents and adolescent health and well-being in times of COVID-19 series. So Mihail, if we could please have the poll questions out. The polling questions, please. All right. So there we have risk of infection and severe COVID-19 illness in young people and so many things. I really can't say all of them. I'm just giving everybody 30 more seconds. This is about you. This series, this webinar is for you, and we want to know what you want to discuss next time. What are you facing? What are the discussions that you would want to hear about, and have evidence-based information and approaches and interventions to really just address these issues. All right, so I'm giving it 30 more seconds. All right, 5, 4, 3, 2, 1. Okay, so Michael, let us close this. Okay, maybe just 2 more minutes. Okay. So let us see the results. Okay, Michael, maybe you could help with this. Okay, so from our results, it turns out that promoting your mental health in times of COVID-19 has been the most voted for. So your wish is our command. On our next episode, we will be talking about promoting mental health. Thank you very much for joining this polling, this poll rather. And at this point in time, I know you're amazing and you've stayed a few more minutes. We're actually just wrapping up, and I would like to just give each of our speakers just a few seconds, just a minute to just really give any last words. It's been amazing hearing from you, but just one last word to just hear from you. I think we could start with Chris.
Thank you. I would just encourage each of us to understand how we, as individuals, have a critical role to play in responding to this epidemic. So just never forget the fact that you make a huge contribution in the future, and please play your role.
Thank you, Valentina.
Thank you. Well, I would encourage participants, because you are already a pre-selected group, to make others maybe more shy or less active colleagues to be part of the active group. So be active, stay engaged, be updated.
Thank you, Shukti.
I think I would just ask all my friends and my teachers and my parents to have patience during this time and to look at this as a big lesson to be learned and be positive about it. Thank you.
Salva.
Well, to the young people out there, they shouldn't forget that HIV, STDs, and STIs are still existing, so they should protect themselves. Thank you.
Wow, thank you very much to all our speakers. That was amazing. Just to remind you that this recording will be shared on the PMNCH website. Do not forget the hashtag Adolescents 2030. And this has been amazing. Our next episode, we will be talking about mental health, because that is what you want to talk about, and that is what we will talk about. I just want to encourage all young people watching this, that sometimes I see a lot of pressure that at the end of this pandemic, if you don't publish a book, what were you doing with your life? At the end of this pandemic, if you don't learn a new school, what were you doing with your life? Well, guess what, sweetie? You don't need to publish a book. You don't need to get a new skill. The fact that you are just surviving is worth celebrating, and that is enough. Take care of yourself. And until next time, I was your host, Maziko Matembu, hashtag Adolescents 2030. Let's keep the conversations going on Facebook, on WhatsApp, on Twitter, and hugs and love to everybody. Woo! I think we should take a screenshot.